Kelly, we are so incredibly excited to have you with us. Dr. Casperson, we met in June, I think, at the Women in Work Summit. And for those of you that weren't there, Dr. Casperson comes up next to me, sits in a chair, and I look down and you've got a cast on your leg, which I didn't
Yes.
expect. And I think that little snafu it was partly due to your lovely black lab, I think. And I'm glad to see that you are all healed. I can't see your leg, but I assume that you are out of the cast.
Yes. Thank you. Yeah, I had just been sidelined by a black lab on a hike. It was like the most Pacific Northwest injury like that exists. And I hobbled my way down to Seattle, had an amazing night. And I was such a good patient. I did the physical therapy, I did the massage, I got checked out to make sure it wasn't anything severe. So I'm like, I think I healed properly and I'm back. I'm back.
Good.
Yay.
Yay. And you're hiking again, I hope, in the Pacific
Yep.
Northwest. All right, good.
Yep.
We're going to go on a hike someday. We were just talking about that before we hopped on here and hit record. Kim and I probably have gathered 100 questions for you today. And no kidding, the list just gets longer and longer, and there's just so much to unpack. We're not going to be able to unpack it all on this podcast, but we're thrilled to have you because I want to start here with your story because your story is really incredible. We were also talking before we hit record on the privilege that we have of leaning into our passion and changing our mind and changing our career. And you've just got such an incredible story in how you started and where you are right now. So if we can, let's dive in and go back to the very beginning. You're a urologist.
Yep.
And how the heck did you start in that trade, first of all, that profession rather? And tell me that story. And then how did you lead to sexual health? Because that's different, right?
Yeah.
What happened?
So for people who don't know, a urologist is a surgeon, a specialty surgeon who operates on kidneys, bladder, technically male genitalia, although there is the niche of female urology, but not all urologists can move around a female pelvis with ease. Kidney stones, bladder cancer, prostate, enlarged men who can't pee, right? So really genital urinary structures is what the urologist does. So when I was looking, I thought I was going to be internal medicine because I wanted to know everything. I bought all the books in medical school. I just loved reading it. And I did a 2-week urology rotation, met only men. I was in Minnesota. There was one female urologist in the entire state. I have yet to remember her, and now I don't remember her name, but there was one in the state. And so I'd never met her. And but the male urologists, they were happy, they were funny, they fixed things instantaneously, which is kind of hard in medicine, right? And so like kidney stone gone, bladder cancer gone. And I was like, because you showed up, big things happened in that day. And that was very attractive, the short-term instant gratification.
Mm.
So I'm like, okay, I'll just do whatever beats urology because you spend another year doing a bunch of stuff and nothing beat urology. So
Mm.
that's what I ended up doing. And trained in Denver for 6 years, was in Bellingham for 7 years when I got my 7-year itch.
Mm.
So for anybody who hasn't heard of the 7-year itch, it's legitimate, whether it's your relationship or your career, something happens at 7 years. You kind of get like you get bored, you get a little, what am I doing? This, and I'm like, oh, recurrent urinary tract infections day in, day out. Did I train for, a decade to tell people to drink more water and pee more?
Yeah, yeah.
And so just kind of having that like career midlife crisis. And then that was when the universe was like, she's ready. You have to be like
Mm.
ready to receive the
Right.
message. So I had a woman come in. I was very bonded with her because I had cured her from cancer years in the past. We used to see each other every once a year. How are you doing? How's things? And she was crying because of her sexless marriage. Great marriage, just not full of physical sexual health, and she was very very disturbed about it. And I'm handing her a box of Kleenex, and the lightning strikes my brain, and I don't know how to help her. And
Mm.
I was like,
Mm.
does anybody know how to help her? Because when I
Mm.
was in training for urology, we were told women were difficult. I was told to do a fellowship so that I didn't have to deal with women. Women are difficult. They took too long in the clinic and we'll never figure them out. And the gynecologists they're dealing with them. Like legit things
Wow.
I was told that I didn't question then because you're the trainee, right?
Mhm.
And so I was like, well, is it true? Is it true we haven't figured any? How come we've been giving Viagra as a prescription since 1998? Who's taking care of the people who are supposed to be sleeping with the people we're giving the Viagra to,
Yeah.
right? And so like all these questions just started coming up for me when I started learning, and I was like, oh, we actually know a lot about female sexual health. It just doesn't trickle down to the people because Hollywood feeds us a load of baloney, and the doctors don't know.
Hmm.
So there's this voice in my head, and the voice was like, you need to talk. And I was like, this voice is super annoying, right? No, I'm fine. But like every morning the voice was like, you need to talk, you need to talk, you need to talk.
Mm,
And one day I was like, I don't know enough yet. Like I didn't, there's one fellowship in female sexual health. Now there's two.
wow.
So that means two people a year in this country get actually fellowship trained in female sexual health. And so I hadn't done one of those. Like all of this, like I wasn't smart enough. Who am
Yeah, all those
I? You know, all
right?
those
Yeah.
messages. So I was waiting for permission for somebody to
Mm.
like tell me I knew enough. And like I was waiting for somebody to like pick up the phone and be like, Kelly, you should start a podcast. And like it was so bad, like I even knew who that person was. I
Oh,
was like
wow.
waiting for permission. And so I got out of the shower one day, and where all good ideas in the shower come from. And
Exactly.
Exactly.
lightning strikes again, and they're like, the only permission you need is your own.
Ah,
Mm.
Do it.
go
And
do
so I
it.
was like, God darn it. Like, that's true.
Right?
So I started a podcast 4.5 years ago, and it's doing very well. It's
Yeah.
like usually in the top 10 of medicine on Apple. It's called You Are Not Broken. And it really started out with sexual health because that
Mhm.
was my like, women need to be educated on this, blah, blah, blah. And so the book came out, You Are Not Broken, Stop Shooting All Over Your Sex Life. Because people, it's like we have all these shoulds. Like you should have sex a certain amount of
Mm,
times a week. You should take this long to orgasm. You should orgasm like this, right? Like we have all these shoulds about what we think sex is. And so wrote the book, and really women started being like, yeah, but you know what happens with menopause.
Yeah.
mm.
And I'm like, what happens with menopause? Right? And they're like, your sex life goes away. And I'm
Uh,
like, is that true? And so
mm.
that was like the next deep dive of like what happened. I mean, I'm staring down the barrel at this
What the
time of
heck is
life.
coming, right?
What's
Yeah.
coming? And so it's then started to get into like, is that true? Are hormones related? Why are we so scared of hormones?
Mm,
What's the truth about hormones and breast cancer? And just started like digging deep on all of that stuff that kept coming up. And then I was like, oh, because of the Women's Health Initiative, we are incredibly number
mm,
one in the dark about what's actually happening. People just think this is a hot flash, right?
mhm.
They have no idea that like it's a profound hormonal change. I say change because people get all moody when I'm like, it's the hormones go very, very low, and people are like, we don't like the word.
Oh,
We don't
oh,
like the
Okay.
word. And
wow.
I'm like,
Whatever.
you guys need to freaking deal with what's happening, right? So
Exactly.
Yeah, yeah,
it's
accept
interesting.
it
It's
and
interesting.
surrender.
Yeah, it's super interesting that women get picky about the word, but about
Uh-huh.
because I had posted it's ovarian decline, I think,
Yes,
or I
yes.
had posted something about ovarian demise, ovarian decline, something, but it was kind of medical. It wasn't demise. And people get all, and I'm like, you guys don't know what this is.
Yeah,
Like
yeah.
it's what it is. And so really started educating about hormones and educating about fear, and then started prescribing it in my clinic. And I'm
Mhm.
a urologist, so we give 10 times the dose of testosterone to men
Right.
like every Tuesday. Like I am not afraid of testosterone, and I know what testosterone, how good it is for people.
Yeah.
So really started kind of becoming the like sex med hormone testosterone guru of the United States of America.
Yeah, you really are. And
And
I
roll
wanna just,
credits. There you go.
note first, you do have a, what do we call it? It's a new release of your book.
Yeah, a
You wrote
re-release.
okay, there you go.
So it's yeah, a publisher bought the rights to the book and is now it's going worldwide. So it's in UK, Canada, Australia
Oh my
right
gosh.
now.
We're
Yeah,
so
So awesome.
excited. It's
pretty
coming in
excited.
September. So you
Yeah.
can pre-order that. I know you can. We're going to put that in our show
I
notes.
did.
Just super excited. I did too. And you're going to have all kinds of fun things with some, private conversations with anyone that's pre-ordered. And so we can't,
Yeah.
wait, right?
Yep. Yeah. It's
We'll
I'm
put
pretty excited.
all of that in the show notes. But I just first of all want to say I love the story. You went from urologist to sexual health expert, now you're hormonal health expert. And I want to dive into testosterone, estrogen, hormones, because there are so many questions about that, as you just said. And you just said something that I don't think that our general audience might realize, that males take 10 times the amount of hormone, testosterone, that we do, right? But there's
Yes,
not an FDA approved testosterone for women that's dosed at that 1/10 of the
correct.
male hormone, correct? So
Correct.
let's unpack that a little bit. Let's talk about that. We also know that testosterone is good for our bodies, not just to increase our libido. So that's where we go. When we talk to women, it immediately equates to sex, libido, and that's the only reason why I need to take testosterone. And by the way, if I take testosterone, I might grow hair on my face and places that I don't want it. And so can we talk about that a little bit? And what the
Yeah.
heck? Why are there so many confusing messages out there on testosterone?
Yeah, it's one of my favorite topics because you have to start. We'll back up for the people because if I just come out of the gate and be like, all women need testosterone, like I sound crazy,
Yeah.
right? Because their lack of education hasn't caught up to like where I am, where I'm like, how do you want it? Do you want to inject it? Do you want a cream? Do you want a gel? Do you have
Hmm.
right? Like you have to catch up to where I am. So all bodies make testosterone. It was labeled the male sex hormone just by a bunch of male researchers because researchers were men
Hmm.
back in the day. And just got labeled androgen, which means if you look it up, it means the male sexual characteristics, but it's completely made up. Men make estrogen, women make testosterone. It's like calling insulin male or calling thyroid female of like, no, these are just things all bodies have. We just have them in different ratios. So the first part of the whole discussion is really cutting down these gendered terms that we used, which kind of puts these hormones in a box.
Hmm.
And it puts these hormones in a box of like, that's for him, this is for her. Side note, men have more estrogen in their bodies than women do after menopause.
Hmm.
Interesting.
Yes.
Men have, a level of 30 to 40 on average, and women have a level of like less than 10. That's estrogen after menopause. So just to open people's minds of like everybody has hormones, everybody needs hormones. The hormones go crazy low in menopause to the point of, I have this woman and she's like, I want estrogen and blah, blah, blah. And I point to her husband and I'm like, he has more estrogen in his body than you do right now. And that really helps him realize like, oh,
Oh.
I have a profoundly low level of estrogen now
Hmm.
because I don't think of him as having estrogen. But estrogen in men is very good for their bone health, is also really good for their libido and sexual health. They've got amazing studies where they knocked out men's estrogen and they're like, eh.
Ah, that's
Right.
interesting.
So, but
Okay.
you don't go around with the stereotype of like estrogen's great for men's sex lives.
Right.
Right.
No,
So
never
Right.
heard it.
you have
I
to
have
back
never
up.
heard that either. Yeah.
Yeah. So you have to back up and be like, okay, so now we know everybody makes testosterone. And the other thing we need to know is before menopause, so when we're having normal cycles, our women's testosterone level is 4 times our estrogen level.
Mm,
We don't know
crazy.
that either,
No, right.
right? So we're always told. Oh, I mean, the other interesting thing is you can't make estrogen in your body if it doesn't go through the testosterone
Mhm.
pathway. So you take cholesterol, and then cholesterol goes into all of these hormones. It first has to become testosterone before it becomes estrogen.
Mm,
People think these are like separate floating things of
Ah,
like, no, we get our estrogen from our testosterone,
from
which
our
is which
testosterone.
is 4 times what our estrogen level is.
It's important.
It's important, but
it,
our body doesn't just use testosterone to make estrogen. We have testosterone receptors in our brains and our bones and our muscles everywhere else. So that's the spiel of like, okay, now we can talk about testosterone in
Yeah.
women
Yeah.
and actually using it as a pharmacologic drug. Once we understand, I'm not trying to take something that a man has and put it in your body that you've never seen before. The other interesting thing to know about testosterone is it doesn't fall off a cliff when your periods stop.
Hmm.
Testosterone starts declining from our 20s and really kind of has a gentle slope down into our 40s where it stays low. Now, the interesting thing, and we need more data on, but we're finding that women in their 70s, their testosterone starting to rise again naturally.
Oh,
We don't know why
interesting.
that's important or why that's happening, but we think those women tend to have more heart protection from it.
Wow.
Interesting data on natural testosterone levels when you're older and risk of heart attacks, heart disease.
Yeah.
So that's infancy research because nobody was really looking for testosterone in 70-year-olds.
Yeah, that's fascinating to
Yeah,
me.
so testosterone it goes down slowly from 20 to 40, stays very low, and then in some women will start to rise again much later in life. Um, but we do not have an FDA approved product for it. The FDA, there's I don't know how else to say it. There's a strong gender bias, right?
Mhm.
We have multiple forms of Viagra FDA approved since 1998. We just got 2 FDA approved medications for women's low libido a couple of years ago.
Mhm.
So we're horribly behind on equity and equality when it comes to equal issues. So men have an FDA approved, they have about 20 FDA approved testosterone
Yeah.
products.
And we have
In a
2, did you just say?
no, for
Well, we don't have
testosterone, we
any
have 0.
FDA-approved testosterone.
For
Right.
testosterone, we have 0.
Right.
And look at the numbers. About 15 to 20% of men, that might be generous, will use a testosterone product because not all men get low testosterone. What percentage of women get low testosterone?
Mhm. Yeah.
100%.
All
Yeah.
of them.
So
Mhm.
if my math was mathing, we would have more products available than the men do. Now,
Right.
the other gender issue with the FDA is male testosterone's FDA approved for hypogonadism, low hormones.
Mhm.
Why do you take hormones? Because your hormones are low. The FDA has said, and it will happen, that when we get a FDA approved testosterone dose for women, it will be approved for low libido.
And
Oh,
that's it.
that's it.
Okay.
Yeah.
That
So
makes me
that's
mad.
yeah,
That
it
makes
should
me
make
mad.
you mad. And so in Australia's FDA, they have their own FDA, but they're FDA approved for low libido in Australia. And so women come to me and they're like, should I lie to my doctor? Should I say I have an issue with my sexual health to
Yeah.
get this testosterone? And it's the tail wagging the dog, right? Because they're like, well, the
Mhm.
most data we have is for low libido. Why is that? Because the FDA said they'll approve one for low libido.
Right,
Right.
right.
So the research follows what you're actually going to get it approved for.
Wow.
We have other data for testosterone, and you only have to talk to a woman who takes testosterone who understands how great she feels, and this is not just for sex. And the other thing to step back of is like, what's libido? Libido's a mood. Where
Mm.
do moods come from? Moods come
Mhm.
from our brain.
Mhm.
Okay, so testosterone works in your brain. Yes.
Yeah. Yeah.
And there's a big role in cognitive health, clarity, thinking. I mean, so many women are like, I'm faster. I'm quicker. The world's
Wow.
more in color. I'm asking more questions. I'm more curious. My German I learned as a kid is coming back. My math is faster. Like
Wow.
it's a brain hormone.
Yeah.
And to say it's libido really is like, you guys, libido's in the brain. Where do you think libido is? It's not in
Yeah,
your thumb.
and
It's
it's
not in
so
your thumb.
limiting. It's just so limiting,
It's
and that's
and
what's so frustrating,
how
right?
sexist is it to say, like, I'm gonna give you something for your interest in sleeping with somebody else?
Yeah,
Right.
that's crazy.
Right.
It's
So
Exactly.
nuts. Like, people should be, well, I only have to open my mouth and actually, like, explain all this, and then people are like, "Who do I
sign me
write?"
up.
And I'm
Yeah,
like,
yeah.
"Write your legislatures, write the FDA. It matters." Right? Insurance companies won't pay for your testosterone, but they'll pay for male testosterone, and they'll pay for people who are transitioning to male testosterone, which, by the way, it's not FDA approved for.
Mm,
But that gets covered. And so women have to be loud to say, I want this. Women pay more out of pocket for their health care than men
mhm,
do.
Oh yeah.
mhm.
And this is one reason why, is because they're like, we're not going to cover it. It's not FDA approved.
Yeah, so much is not covered. I remember when I was taking birth control. I mean, this is aging me, but I don't care anymore. They didn't cover it, right? So
Yeah.
here we are in 2024, and we're still having the same conversations, and that's incredibly frustrating. So
Yeah.
what do women do if there isn't an FDA approved testosterone and we don't understand how testosterone affects our body? What do we do? Right? So here we are and we go to the doctor and they might say, "Well, you need hormones." But I have never had a doctor talk to me about testosterone.
I
It's
just had a
always
whole
estrogen and progesterone. I mean, it's
I
just
yeah,
that's
always. And I just had a
it.
whole blood workup done on everything, on everything. and on the hormone piece, testosterone was not on there. I was looking again this morning as we were preparing for
You're like,
this,
Yeah.
because I was like, where, and I love my doctor. She's super smart and would like do the right thing, but it seems like I need to specifically ask
Uh-huh.
for my testosterone to be checked.
you
Yeah.
do.
So
I mean,
that's
you
broken.
do at this point. I listen, I went to medical school and didn't learn that women had testosterone in their bodies. And it was probably only like 3 years ago where I learned that we have more testosterone than estrogen in our bodies.
Hmm.
Like, shut the door. So
Hmm.
unless you're like, I'm innately curious about these topics, right? And so my level of education now is not where I was when I got done
Yeah.
with medical school. And so doctors have to be innately curious, or they have to learn from other doctors, because once you're 10, 20 years in practice, you're not learning new things
Yeah.
unless you're like very interested. But this is how the change happens. Women go in and they request and they ask and they demand and they repeat themselves.
Hmm.
Because I've had many doctors come to me and they're like, listen, I need to learn this now because women keep coming in,
Yeah.
right? And
Yeah.
so thinking about, how do we change systems? Do we change systems from top down, or do we change systems from bottom up? And I really think with the hormone menopause world, we're changing the system from the bottom up,
Hmm.
because if we are expecting there's 1 million doctors in America. If we're expecting 1 million doctors to get an education that they didn't get, or they got the opposite education because they trained during the
Yeah.
Women's Health Initiative when remember
Mhm.
hormones caused cancer for a while?
Yep.
Now
Right.
they
Yep.
now they don't again because that was bad research.
Right.
But we can't wait for doctors are too busy.
Right.
We're too
Exactly.
busy.
Hmm.
And so to me, I'm like, I educate the woman, she goes in, and that's how we get it to change. But going back to the specific testosterone issue, it is a big issue. And this is kind of where the pellet wellness
Yeah.
clinics
Let's
come
talk
in,
about this. Yep.
is because our healthcare system, number one, doesn't pay for these products. Number two, isn't educated about these products. Women will go to these clinics where all they offer is pellets.
Mhm.
And to me, I'm like, if you only offer one type of hormone, you're
Yeah.
not a hormone expert. You're a one-trick pony, and you're
Right.
making money off those
And you're making
pellets.
a lot of money. Right.
Yeah.
Uh-huh.
Right.
But I get it. I understand
Yeah.
why women go. And
Hmm.
and some women do very well. If everybody did poorly, they'd shut down,
Yeah.
right?
Sure,
Yeah.
sure.
So some
Exactly.
women do very well, but pellets are super physiologic. So they're going to take you, if you're already in a low state, and now I shoot you past normal and I put you up really high with these levels, whether it's estrogen or testosterone, um, side effects happen.
Hmm.
And
Because you're
then,
getting a high dose fast and quick.
yeah.
Right.
Yeah, my,
So.
my analogy is like, we live at sea level. If you
Uh-huh.
fly me to Everest Base Camp, I'm going to fall over,
Yeah.
right? Like I'm not used to it. But like if you fly me to Denver, I'll probably be pretty happy in Denver. Like Denver's
Yeah. Oh,
okay,
I'm so going to use that. Yeah.
right? And so to me, I'm like, get to Denver. Then
Uh-huh.
there are some people who like going, they might want to go to
Hmm.
Nepal, but like a lot of people are happy at Denver.
Yeah.
So hang out there. But yeah, so the side effects can be irreversible. Really high doses of testosterone, enlargement. So really high doses, think 10 times the male dose. But high doses that you can get enlargement of your Adam's apple. You can get irreversible clitoral enlargement. You can get androgenic alopecia, which is male pattern balding.
Mm.
Um, and so again, not everybody. That's why
Yeah.
these places exist. They exist because Western medicine's failing people, insurance companies aren't covering it, and women want to feel better. I
Yeah.
get why they go there.
Yeah.
I just don't think it's the most comprehensive, best way to get your hormones.
Yeah. Go ahead,
How
Kim. You
can
got.
how can women advocate for themselves? You were saying like, show up and ask for it, but you're doing a lot of education, and we want to talk about your book too. Very important work that you're doing there. But how should women think about how do they get informed? How do they ask for what they want? How do they help change it? Like you said, ask the doctor, but what would you tell our
Yeah.
audience about
I,
really
to,
how to move the not dial?
Mhm.
I mean, to me, I'm like, there's good people, whether I always ask women, how do you like to consume your content, right? Do you like to listen? That's a podcast. Do you like to read? That's a book. Estrogen Matters is an incredible book about hormones. My book for You Are Not Broken for Sexual Health, to advocate in the office for sexual health is very uncomfortable. The doctors are uncomfortable. The patients uncomfortable. Everybody's uncomfortable.
Yeah.
So you can say, hey, I've read this book. I brought this book in. And for when women come and see me, like I've made my job really easy by working really hard. because now when women come see me, they're educated. They've
Mm,
listened to my podcast, they've
mm.
read the book, they're on my Instagram. They're like, they're not,
Let's
yeah,
go and have this conversation.
exactly. They're not scared about,
Yeah,
you have to get over so many barriers. You have to
yeah,
get over the fear of hormones. You have to get over, so many issues in navigate. I didn't even know hormones got low and right. Like all
Yeah,
this
yeah,
yeah.
education
yeah,
before you can say you can go advocate. Right.
Mhm,
yeah,
mhm,
And so to like when women come see me, they're just ready to go because they've
mhm.
done that already, and
right.
it's more fun for me because now we can just talk about really high level stuff or
Yeah,
like other cool stuff. So it's education first,
Mm,
then you can't be empowered about this stuff if you don't know, right?
yeah,
So
yeah.
education, then empowerment,
Yeah.
then
And
go
I think
mask.
there are a lot of hurdles still. I mean, you mentioned the study in 20 years ago that is still scaring the dickens out of women right now about hormones. And we're still having that conversation with women that hormones are safe.
Yeah.
So
I
you
mean,
have that
yeah,
barrier and then, right? And then. So advocating,
seeing,
I think,
s-
comes back to education. I agree.
yeah, and knowing who you're seeing, right? Which is not always easy, especially if your insurance is limiting to you to be like, these are your 5 doctors you get to choose from.
Yeah.
But so seeing somebody who's experienced in sex med, that's probably the best tip is sex med docs. And if you go to ISHWISH, International Society for the Study of Women's Sexual Health, ishwish.org, you can type in your zip code.
Okay.
So what a sex med doc, why they're so special is number one, they're comfortable talking about sex. But number two, they understand the role of hormones in sex life. So they're usually pretty proficient at hormones as well. So
Okay.
that's kind of your like 2 for 1 for being like, they've already had this conversation 10 times today.
right.
Right.
It's going to be awkward no matter what. Like, I get it. Like, it's hard to talk about personal stuff. But like seeing somebody who's like, yeah, I do sex med and hormones, it's a heck of a lot easier.
Yeah.
I mean, the other thing, if for primary care, there are 74 million midlife women in this country. We need all doctors on board with this, right? We need
Yeah.
everybody. But if you don't have a relationship with a doctor, which I think the doctor relationship in this country is at its
Yeah.
worst
Awful.
all-time low because people move and jobs move now and you're not in a community like you used to be. And
Right.
so, I'm fortunate. I've had my primary care doctor for years. She knows who I am. She knows what I do. So she's very willing to she's like, Kelly, just tell me what you want. Right.
Yeah,
Right. Right.
But not everybody has that. And not especially if you have a doctor who doesn't see a lot of menopausal people.
Right.
Doesn't think that anything happens with the vulva with menopause, right? Like somebody who knows what happens to your sexual health and your hormone health as your hormones change is incredibly important. And the relationship is important. They trust you. They know you're going to come back. They know,
Mhm.
you're not asking for something crazy. And like that's a relationship. And I think for hormones, be like, can I try X, Y, and Z? I will
Mhm.
come back in 3 months. We'll adjust as needed. Those
Right.
are the magic words when you ask a doctor for a prescription.
Mm. Okay. Can you
Let's
say
just
that
try.
again then?
We're
Say
going to
that.
try. Can we try X, Y, and Z? I will come back in 3 months and I will tell you how I'm doing and we'll adjust as needed.
Okay.
That is the magic word for getting a prescription.
Okay, we're going to add that to our resources as well
for
when we do
sure.
our training. Really, because we talk to women about how to approach your doctor and how to best prepare for those doctor visits. And this is really great information
Yeah,
for them to advocate for themselves. I want to talk about, can we go back to testosterone for just a minute before we move on? And I want to talk about your book. Um, when we are looking at testosterone and dosing and the fact that there isn't an FDA approved level for women, how do you do that? What does it look like? So
Yep.
there's still that confusion, right? So if I go to my doctor and I'm asking for this, not just for libido, what am I looking for and what am I asking for?
Yep. So we always get a baseline testosterone just to see where it is. There's the rare woman who's going to have a high testosterone. You don't want to give her more testosterone. I've never seen that woman because most of my people are postmenopause and late perimenopause. But so get a baseline. That's how you know
Okay.
that it's low to begin with, and that then you recheck it in about 2 months, and you can say, oh yeah, you're absorbing or you're not absorbing or
Okay.
you need more and blah blah. So I like to follow this with levels in the beginning.
Okay.
Um, there's two main options. Pellets aside, pellets are an option, but again, I think you have to work your way up to a pellet. You've been on testosterone for a while. You just want like an easy every 3-month dose instead of a daily dose. You know
Mhm.
that you're where your levels, and you like your levels to be a little. So to me, I'm like, earn a pellet if you're going to do a pellet is how I think about it. So
Okay.
I never advocate for off the bat pellets, because there's just too many women that go from 0 to 300 and
Yeah.
don't like it. So with what I call physiologic dose testosterone, so I'm giving a woman a little bit maybe higher where she was when she was like 32. Right. I
Okay.
mean, the best thing to do would have been to check all of our labs when we were 28. That would have been nice.
Mhm, mhm.
But
Maybe that will change too.
no, yeah, right. Nobody has that. So we're a little bit guessing of like where you were happy with your sex drive and your energy and your, lean body mass and stuff like that. But get a baseline. The two main ways to do it is you can take the male dose or a male product, which is Testum or a testosterone gel, and you make a tube or a packet. Bonus if you can get the tubes. I
Okay.
go through Amazon. Amazon's nice. You get the tubes on Amazon. And you'd make a tube last 7 to 10 days.
Okay.
Now, that's not accurate, but I would argue like it's pretty darn good. It's going to
Okay.
get you like, for the women who are like obsessing over 1/10 of like, maybe that's not the right way to do it for you.
Okay.
So that's great. You can get a prescription of 30. So it comes in packs of 30 for men. It's a 1-month supply.
Okay.
And then you take that and you do 1/10 the dose. So that's going to last you 300 days. So it's going to last
Mhm.
you 10 months. And that's, I think, $211 on Amazon
Okay.
Pharmacy.
Yeah.
It's
Yeah.
just
Not bad if it lasts
Costco
10
also
months.
is,
Yeah.
yeah, very cheap. Now, a lot of, and why is Amazon nice? Amazon's nice because I don't have a pharmacist in the middle of a grocery store chiding my woman over, do you know what you're doing? Because some of the pharmacists get a little bully on this.
Okay.
And
Okay.
so if you go mail order,
You
you
don't
don't
have
have
to talk to
you don't
them.
have to.
Yeah.
I got mine got approved on Amazon and came to and it comes to your house too, which is nice.
So
Okay, so
okay.
that's the dosing the male FDA approved product. Then
Okay.
recheck your levels in about 2 months, 2 to 3 months. And on that, some people it takes 4 to 6 months for you to notice, right?
Mhm.
So give it some time, check your
Mhm.
levels, make sure you're kind of up. The other problem with testosterone is the female range on labs, I think, and a lot of experts think, is low.
Okay.
So if a female lab dose they're going to say anything over like 30, 35 is a high testosterone. I disagree. A
Mhm.
lot of studies show that women do really well in the high double digits to 150,
Okay.
without getting a lot of side effects. So you have to kind of go to somebody who knows how to interpret these labs, because
Right.
I don't
Yeah.
even
Sure.
think the labs are that accurate. The Quest labs, for example, their female testosterone range is based off of one paper.
Oh,
So
wow.
you have to
Okay.
understand your labs, right? You have to
Right.
understand why your lab says what's normal and what's not normal. So
Yeah.
recheck your labs, but do give it 4 to 6 months. And they say if you don't notice that any improvement in symptoms after 4 to 6 months, you can stop.
Yeah.
Now,
Okay.
I might argue, because I'm the hormone expert, testosterone's helping your bone,
Mm.
testosterone's helping your heart, testosterone's helping your brain. You can't always feel those things,
Mhm.
Right.
That's
right?
long-term health,
And that's
right?
another
Long
podcast
term.
for the preventative use of hormones,
Right.
which is kind
Yeah.
of, that's where the thought leaders are now, right? And it really mainstream is like, what symptoms do you have? Do we help your symptoms? And then the
Right.
thought leaders are like, you can't
Let's
feel,
think about your
can't,
whole
yeah,
health span.
you
Right.
can't
Yeah.
feel your insulin working, but you'd
Yeah.
like to know that it's working on right. Same thing with the sex hormones. So
Right.
those are so that's male testosterone, FDA approved. The other way to do it, which is easier, is get it compounded at a compounding pharmacy. 5 milligrams a day, one pump,
Mhm.
90 pumps. There's your 3 month supply. It's about $70. One pump to your leg every day, easy.
I kinda like the pump.
Yeah.
It's a lot
I
more
have the
idiot
estrogen
proof.
spray, I'm like, "Let's just
You
take."
like
Yeah,
the once
okay.
a day
I like
estrogen
the once a day because I
hormone.
don't have to
Yeah.
think about it. I don't have to do math. I don't have to figure out what day it is and did I take
Yeah.
it and, all of that. So
Yeah.
that sounds better to me.
And my opinion about this is 100% of women will have low hormones. We should have 20 different product options. We should have 30
Yeah.
different product
For sure.
options. Like
I agree.
the
I'm
fact
a
that for
huge
estrogen we only have 4 options for
Yeah,
something that affects 100% of people. To me, I'm like, where's the innovation?
yeah.
I
It's
I want
there. It's there and there's an
I know.
opportunity. This
I
is a
know
whole other
but they jack
conversation
up the
too.
prices.
But
I
the
want a
why,
ring.
right? Why?
I want a vaginal ring that has testosterone, estrogen, and progesterone in it.
I was going to ask you the
I'll sign
question,
up for
what's
If
your
that.
I got
list?
to
If you
design
could,
something,
right?
that's
What
what
would
I would
you
design,
do?
because then it would cover my vulvar,
Uh-huh.
bladder, vagina, all of that, those structures too.
Yeah.
That would be the best.
Because we haven't even talked about that. We haven't even
No.
talked about the vagina vaginal atrophy. I know you're a huge fan of that being preventative medicine as well, right? We
Yeah.
need that vaginal estrogen. Why even wait until we're having painful sex? Why
That's
are
the big
we waiting
question.
until
Why are
right
we waiting?
after?
Yeah.
I mean, I think I think we wait for two reasons. I think we wait for three reasons if we have
Okay.
the time. And the first reason is Western medicine is very good at treating disease, not preventing it.
Mm-hmm.
And if I'm a doctor who's into preventing it and you come into my office and I'm like, oh, you're 45, here's your vaginal estrogen. I've got 8 more minutes to talk to you about it. You don't know what estrogen is. You still think estrogen is going to kill you.
Yep.
Your insurance might not cover it. You
Mm-hmm.
are uncomfortable talking. Like, it's a big ask to be preventative for the average person,
Yeah.
right? But to me,
Yeah.
I'm like mammogram, colonoscopy, vaginal estrogen. Here you go.
Yeah.
Because the average, so that's number one. Number two is sex is difficult to talk about, right? How many women come see me? They've stopped having sex 8 years ago, right? 8 years ago, 6 years ago, 5 years ago. This isn't like a sex hurt once, I'm going to get it checked out,
Yeah.
which is what men do. Men are like, erections were iffy one time. Check this out, right? Whereas
Help.
women are like, it just started hurting, so we just stopped having sex. That
Wow.
was 8 years ago.
Mm-hmm.
Right. And then the third reason is women because we don't know what menopause is, and we think it's the end of periods and a hot flash. We don't understand that the pain with sex is because of low
Yeah.
hormones.
Right.
Right. Right.
And
Of
so
course.
those are the three reasons that vaginal estrogen isn't happening at age 45.
We
But
need to
I had
that.
this insight the other day because, I'm a big preventative, and for people who don't know, vaginal estrogen's incredibly low dose. There's literally hardly a person who can't be on it.
Mhm.
There's always an asterisk of, oh yeah, you can't. But like breast
Mhm.
cancer survivors, everybody for the most part can be on vaginal estrogen.
Because it's not systemic.
not
It's only
systemic.
treats that area.
It's not going to help. I always say it's not going to help your bones. It's not going to help
Yeah.
your heart, and it's not
Mhm.
going to help your brain. It's of such low dose. It's only for bladder health, vagina health. Vagina and bladder share a wall, so they're
Mhm.
condo mates. So vaginal, yeah, it's just so incredibly important. But they don't know that the hormone changes is why you get overactive bladder and you start getting up more at night and you start
Right.
getting more recurrent UTIs and all those things. People
Right.
don't know that that's a hormone thing.
Yeah.
There is
Just
so much that is related to hormones. It is
It's
mind-boggling.
everything. Hormone
Don't
receptors are
understand.
everywhere. Vertigo,
uh-huh.
ringing in the ear, joint aches and pains. There's
Mhm.
finally a paper just got published like 2 weeks ago, which it was, to my knowledge, the first time this has been written in the medical literature, the musculoskeletal syndrome of menopause.
Oh, so good.
And
Wow.
it's 50 to 80% of women,
Yeah.
joint aches and pains, because in our collagen, our tendons
Mhm.
all have testosterone receptors, estrogen receptors.
Yeah, here I'm raising my hand on that one,
Yeah,
right?
Right?
no,
You're like,
yeah.
hello, yeah.
But if you
I
look
wish
at,
you would have told me that 5 years ago.
right? Yeah, yeah, your shoulder's starting to get stiff, throw on an estrogen patch.
Yeah.
What was I going to say? Oh, the top two reasons that women stop having sex in midlife are availability of partner and systemic hormone menopause changes. Hot flashes, night sweats, poor sleep, joint aches and pains. You don't feel good. You don't feel like yourself,
Right.
right? And so that libido follows that.
Right.
And certainly if you're having pain, dryness, issues with penetration, you do not want women will come in and they'll be like, I have two problems. I have pain with sex and low libido. And I always like to take problems away from people because you don't need more problems, right? And I'm
Yeah.
like, no, you have one problem. You have pain with sex. You can't
Right.
expect a libido to happen
That's right.
when there's pain with sex.
Yeah.
So I'm like, you fix the pain with sex, you make sex fun again,
Yeah.
libido can follow.
And there's
Well,
good news. There is good news, right?
yeah.
We have hormones. We have things that can help with all of these challenges. So
Dude,
that's the good
yeah.
news. And I
My
think you,
my perspective, this is all good news.
yeah,
People are
Yeah.
like, "We're getting older." I'm like, "Damn right you are. It's a freaking blessing."
yeah, we
Like,
get to, right? We
this
get to live longer.
this myth that we have to deal like that it's like some burden, and I'm like, 200, 300 years ago, the privilege of living past 47,
Mhm.
like it was not universal. It's universally accepted that you're by and large going to go through menopause now.
Yeah.
That was a privilege offered to very few
Mhm.
until very recently. And I like to remind people of that, of like, we're figuring out aging on a global scale for the first time ever.
Yeah.
Yeah.
We did like, to me, all of this is a privilege of like, oh my God, I have to floss. It's like, yeah, because you still have teeth.
Yeah,
Like
aren't
it's a
you lucky?
privilege, right? Like, oh my God, I have to wear a seat belt. Like you don't think about it's like a privilege to drive the car and you know what
Yeah.
makes it safer. And so I think, and it's just that little healthy dose of like reframing of
Yeah.
like, oh my God, to have the opportunity to be on this earth for 80 years,
Yeah.
that's brand new.
It
Yeah.
is. And you're right, it's a privilege. And I do think that reminder and shift in perspective is incredibly important.
Yeah, I mean, I
Yes.
just like to break down everybody's limiting beliefs, right? Because they're
Yeah.
like, hormones aren't natural. And I'm like, you have shoes on.
Yeah.
You have heat, right? Like you have glasses.
Yeah.
Like why? And people will say that about sex too. They'll be like, I have vibrators. They just seem so unnatural. And
Yeah.
I'm like, I have two vibrators for my mouth. I have like an electric toothbrush and a water pick. Like, why are you picking your natural for this one thing in your life?
Yeah.
You have a mysterious magical internet that comes into your house and you can buy pants.
Right.
Like we're living in magic at this point. And for
We
people
are.
to get all like naturally with hormones and sex, I'm like, you're picking
What?
get rid
Yeah.
of the internet then because that's not
That's
natural.
not
No,
natural.
nobody's gonna get
Yeah.
rid of that, right? Like so it's like you just change people's their moody perspective a little bit to be like, it's kind
It's a
of
good reminder. It's a good
it's a good
reminder.
reminder.
Yeah. It is a good
But
reminder.
I mean, to me, I'm like, we have a new responsibility to age well
Yeah.
because never have we put a body through 40 years of low hormones and expected the bones not to break,
Right.
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 That's a
right?
good
Like
point.
the risk of hip fracture for us now is legitimate
Yeah.
because we're going to go 40 years without hormones.
We're
And
learning how to do that.
we're
We
learning how to do
are
it. We're learning how to
learning.
age on a global scale for the first time ever.
Yeah.
And
And I
if
think
you,
that's what our age group is doing, right?
yeah,
I
Yeah.
think we really are. We all have daughters here. We want that to be different for them. And we're changing that and we're learning so that they can grow older better.
I think a lot of us are watching our parents and
Yeah.
we're starting to say, I don't want that.
Yeah. I
Exactly.
agree.
Yeah.
Mm-hmm.
Right? How does that not happen? And the truth is, you have to start now.
Mm-hmm.
You can't start when you're 73.
Right.
You can. Some people do. I do start older people on hormones. That's another podcast episode.
Yeah.
But by and large, protect your bones before they are weak.
Right.
Protect your mind before it's having issues.
Right.
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 And again, it's a mindset change because in Western medicine, come see me when your hip breaks. Come see me
Right.
when you have dementia. Women are saying, I don't want to do that though. What can I
Mm-hmm.
do to prevent things? I'm like,
Right.
if there was a drug that men could take that made them live longer, decrease the risk of colon cancer by 30%, increase their lifespan by 3 years, decrease the risk of heart attack by 50%, decrease the risk of all bone fractures by 30 to 50%. Do you think they would be on this drug? And everybody's like,
Exactly.
yeah, a dude would take that. Those are good. Oh,
Yeah.
decrease your risk. If you have prediabetes, it decreases your risk of diabetes,
Right.
developing that by 30%.
Mm-hmm. Mm-hmm.
Everybody would be on that drug. It's called estrogen.
What are we questioning?
Yeah.
Right.
What are we questioning?
Seriously, what are we questioning? I'm going to ask you this question because I really want you to say it because you're a doctor. If I say it doesn't have the same
Uh-oh.
level of respect,
No
but I
pressure.
want
No
to ask
pressure.
you a question here. So, for the record, you just talked about preventative care, right? Why not take these drugs, estrogen, as a preventative medicine for all of these things that you just mentioned? What age? And I know that that is really hard to say, this particular age range, let's just say age range, would that be? What
Yeah.
age range would that be?
Well, average age of menopause in America is 51.
Hmm.
We know your hormones don't fall off. This is the other myth of like that periods are irrelevant. I got some heat for saying that on the internet the other day. But like people use periods as a marker
Yeah,
of
for
then now it's
everything.
okay to
Hmm.
start they're irrelevant.
Yep.
They're like you've got a little bit of some hormones sometimes when you're still having a little bit of periods, but it doesn't like there's no cliff that you drop off of. The new push now is we are severely under treating our perimenopausal women.
Hmm.
Massive suffering, and many people would argue more suffering
Yeah.
because the body's very sensitive to changes in hormone
Mhm.
levels. Once your hormone levels are just flatlined, like it actually things mellow out a little bit. Not
Right.
entirely, your bones really start taking a dive, like the heart disease, the things you can't see, but like mood, sleep, hot flashes, joint aches and pains, like the perimenopausal woman, because of the fluctuation, is suffering without help
Mhm.
the majority of the time. So
Right.
but by preventative, if we're having the preventative question, some people would argue perimenopause because the biggest rate of bone loss is in the final years of perimenopause.
Mm.
So you could argue that. To me, I'm like, listen, by mid 50s, start having the
Yeah.
conversation.
Yeah. I
And
asked
you
that
and you
question because there's often, well, I asked it for several reasons, but we often hear from women, I don't need to worry about that right now. I don't need that information because I
I've
think
already been through
that,
it.
yeah, or
I am.
well, either you're postmenopause and I don't need to worry about, oh, I've been through that. I don't need that. I
yeah,
don't
they think
need
it's ended
information.
because
You're
they
like,
don't
wait
know
a
what it
minute.
is.
Right. Or yeah, the perimenopause stage, right? Like I had no idea that all of this was happening to my body at this young age. I never thought that I would have to think about menopause and hormones when I was late 30s, early 40s. And I went through early menopause. So smack me in the face, right? Like, oh, yeah, yes, you actually do need to have those conversations, April. So I do think it's important. And that's why I asked it. So thanks for
I mean, we all
setting
have
the
that
record straight.
bias. We all have that bias in our head, right? Like when I close my eyes and think of a menopausal woman, I'm thinking of Betty White on the Golden Girls,
100%.
right?
Well, if you
And
Google it, if you go to Adobe Stock, right? Okay, so we use Adobe Stock, everybody, for all of our stock images for whatever, right? If you type in that search bar, menopausal women, that's what you get.
Mhm.
That's what you get. Betty White with a
Yeah,
fan, you right? Like waving herself
yeah,
because
un
she's
and
having this
untreated,
horrible hot flash.
and
And you're like,
untreated,
come
yeah,
Yeah.
on, come on.
yeah. I mean, the myth that women, our bodies were made for suffering,
Yeah.
so we should suffer. Like
So
it's a
stupid.
very oppressive language.
Yeah, we don't have to suffer, and it comes back to
No,
there
and
is help, and advocate for yourself.
it's
Darn
kind of
it,
like
advocate for yourself.
yeah, it's kind of
Right?
like the body positivity world of like
Yeah,
just get to neutral, just get to where you accept your body. It's like no, 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 no. You can actually feel really good,
yeah, you can
right?
feel
Like it's like
good.
this like good enough to be neutral of like no, no, no. You can actually love your body and you can actually feel good when
Right,
you're this age. You
right.
might need to do some things, you might need to prioritize your health. And I think that's the important takeaway also, like for both for sex and for hormones, is like these things don't exist in a bubble. Like hormones are nice, but that's not just your sex life. That's not just men. Like you need to exercise. And for
Mhm.
sex is like you need to know how you get turned on. You need to set aside time for that. You need to work on your mindset about what you think sex is. Like it's not just like here's some vaginal estrogen,
Oh,
enjoy sex.
mhm.
Of like if you think hormones are the only thing, you are going to be disappointed.
Yeah,
But hormones are tools, they're messengers, and they can be profoundly helpful. But you still got to do all the other things.
yeah,
Yeah.
yeah. You have to
Sorry.
do some work. You have to do some self-reflection. You have to take the time and pause.
Yeah.
And sometimes we're scared of that, and
Yeah.
sometimes we don't give ourselves permission to do that. But
Well, and Kelly, you said when I heard you speak at the Women in Work, you said you ask women in the when they come to your office, what do you want?
mhm.
And it made such an impact on me to just like I even ask that question about what it is that you want, and that so many people are like, I don't know.
Mm.
I don't
We haven't
know.
asked her. We haven't asked
We
ourselves,
haven't
right?
asked ourselves.
Uh-huh. Uh-huh.
So
Yeah.
thank
You
you
know,
for
and
that.
I
'Cause
do
that
want to just kind of like chime in and say, yes, you've made a huge impact on Kim with that question, because it keeps surfacing
That's cool. That's
since
very cool.
June. Since
Yeah,
June,
since
Kim,
June.
right? I mean, like, she keeps coming back to that, and I'm like, really important question.
I
So
mean, it's I think ancient philosophy or lots of self-help of like tune in because your body because you do know.
You do.
you do.
You got to get quiet and you might have to try something other, but you like that's the magic of it is like you do know.
Mhm.
And I think for some people they're like they've just been telling themselves they don't know. It's like, you do.
Or don't know
Mhm.
how to listen. Like you, when you
Right.
heard I need to speak, you were like, no, 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 no. And then you kept hearing it and you kept hearing it, right?
Yeah.
Quiet
Yeah.
enough to listen.
Oh yeah,
And
that's a good way to end this podcast. So I was at a
Okay.
conference, I was at a physician conference about a year later. I had started the podcast, blah, blah, blah. And the voice got quiet. For those who are listening out to that end of that story. So the voice, she got quiet. And there was somebody speaking at the conference, and they said that what that voice is your future self pulling you forward.
Mm.
And I was like, oh. So now, I mean, she talks to me every once in a while. And she
Yeah.
like 2 years ago, she's like, you got to quit your job. You got to open up your own clinic. You don't do this urology thing full bore anymore. And I knew the voice. I knew the voice enough now. Like I trusted her on the whole podcast journey thing. And then I knew she got quiet when I was doing what I was supposed to be doing. And now she's like, you need to stop
Uh,
this
she's
urology.
back.
and you are.
Back.
And no, and then I'm like, God damn it.
Yeah, she's back. Yeah.
But now I trust her and I'm like, hi.
Yeah, like,
Oh,
hey, it's good to see you,
really?
right?
I have to quit the good. Yeah, that's what I got. Okay.
Yeah.
But
That's exciting too. It's really exciting that you're opening up your own clinic. That's in Bellingham, Washington. So,
yeah.
if
And
you're,
I mean, to me, I'm like, I want the doctor-patient relationship.
yeah,
It's gone. It's completely gone with the current health insurance model of everybody's moving around and your insurance drops so you can't
yeah,
see that person anymore. And
exactly.
when you do see that person, you see them for 10 minutes. Like the doctor-patient relationship is gone. And me having doctored this long now, what people want, they want the relationship.
Yeah.
They want to feel heard. They
Mhm.
want to feel like somebody cares.
Yep.
That's the doctoring that I want to do.
That's so great.
And so I have to get out of the broken system in order to do it
Yeah,
because our system doesn't, the doctor patient relationship is not, it's not on the top 10 things that matter.
it's not.
Western
You're
medicine is really
close.
good at breaking a femur, fixing a femur fracture. We're very good at a lot of things,
Sure.
but that doctor patient relationship and being like, I don't know what your exact hormone combo is going to be, but I'm here to figure it out with you. Let's
Yeah,
try something.
let's figure it out,
Let me
right?
know. Let me
Yeah.
know how I texted one of my patients last night and I'm like, are you sleeping?
Oh,
Her big thing was she was not sleeping, right?
uh,
Hadn't slept in years.
wow.
And so I texted her, I was like, you sleeping? And she's like, I slept till 10 in the morning. I haven't done, and like she was ecstatic. Like, that was she hadn't overslept a job or something.
Yeah.
But she was like ecstatic.
Wow. Wow.
And I'm like, that's what I want.
That feels so good.
I want that
It feels
relationship.
so good. Not just
Yeah.
for her, but you too, right?
Oh yeah, totally. To be like, look what I did. Yeah.
Yeah, yeah. Well,
Yeah.
your information on your new clinic will be on your website too,
Yep.
kellycaspersonmd.com. So, all of your information is on your website. I love your website, by the way.
Thank you.
But we end all of our podcasts with a rapid fire. So we're going to rapid fire and get to know you a little bit better. And then we have one question that we ask every guest, and we'll get to that in just a moment. But you're a Washingtonian, you're local. We were talking about the beautiful Pacific Northwest that we live in, but curious. We have lakes, oceans, rivers. What would you rather sit by with a cup of coffee?
Water.
Yeah, what body of water?
Oh, I look at a lake right now. So lake is good. Ocean's good. Any water. I grew up in Duluth, Minnesota, so I had Lake Superior in my back door.
Okay.
So
Okay.
water to me.
So water just doesn't matter.
What's
Yeah,
the best
okay.
piece of advice you've ever received?
You're in charge of your own education.
Love it. Thank you, Dr. Casperson.
Thank
That's so
you.
fun.
Sorry, I have to
Thank
run.
you.
Thank you for
Have a
listening.
wonderful day.
We
Go
went
find joy in
long.
the journey.